I think natives are more vulnerable to any type of diseases out there, basically because, according to our genetics and DNA, a lot of people were, affected by diseases that came from over to the country, and it affected everybody and killed a lot of people. So even to this day, we're still in that vulnerable stage, I feel, um, with people not getting their vaccinations like they should. For adults, I think some go with it and some don't. There's some that will get the flu, if they're, an advocate for themselves, they'll get the flu shot. And the others that don't get it, then they're going to be feeling it, that's for sure, without having the protection against flu. They're going to be hurt hard. I still get my flu shot, and my husband right before fall time, so that way we're protected. It just goes in stages because, like I was saying, they either get the shot or they don't. There's some that I've noticed back, years ago where they just didn't get it at all. And it affected them hard. Don't come crying to me that you got the flu when you had opportunity to prevent it, I don't know how to explain it, but we're kind of like the silent people. And people, it's not in their culture to say, you need to get this vaccination. And sometimes they don't understand what a vaccination is. Like in my culture, Navajo Nation, I don't think there's a word to explain what a vaccination is. They'll describe the disease in the language, but they don't know that you can get a shot and it'll help get rid of all these symptoms. Some of the medical terminology for those who aren't the speakers of English would understand it more better if it were described more better in that situation. You should have considered getting the flu shot. That would have helped you from being so sick and not missing work or not missing school or any type of sport if you're involved in, or, socialize with your friends and people and family, because once you get it, you're not going to be able to interact with people because you have to kind of hibernate yourself, from passing it on to others who do not want to have it, Do you know of somebody in your own family, your friends, maybe a neighbor that you're close to that you could ask, did they get the flu shot? Where did they get theirs? Again, there's nurse advice, they're really helpful too. There's usually, here in New Mexico, they usually have a 800 number for nurse advice. So you can just call and then they'll have their resources from there too. Or you can just see a clinic, nearby and just ask, or maybe they can give it, or there's also public assistance out there, those type of offices that can also direct you where to go. Sometimes people get affected differently. Maybe they just have one symptom. Maybe it's just a cough, or maybe it's blowing their nose a lot, or maybe they have a temperature, just little singular symptoms, and they think that's, oh, the flu didn't affect me, but it depends on the person, and their health status. If they're healthy, yeah, maybe they won't get it as bad. But for a person in like my health situation, I would be affected very easily. So it just depends on the person's health status, But I would still encourage them to try and get one anyway, because they could pass it on to me or anybody else who's vulnerable too.